Dr. John Torres here with NBC News, Dr. John as they call me, with this Facebook Live. I want to go over some headlines that occurred over the weekend, and you've probably heard about. Get a little deeper into those headlines so you have a better understanding of what they mean, and particularly what they mean for you going forward here during the pandemic, and how those headlines, how that news can help you, your family, your loved ones, your community survive the pandemic as best as possible and help shorten it, because that's the main goal here, to make sure that we get it over with sooner rather than later. And then I'll go ahead and answer some questions that you might have. So if you have questions, please send them our way and I'll get to as many of those as possible. Let me start off with the headlines. I'm going to cover 3 different headlines today. One, well, we're about 11 days away from Thanksgiving, so I wanted to just talk about Thanksgiving safety and what some of the recommendations are, because you probably heard a lot of people over the weekend talking just about that, and what you can do starting today to minimize your chances of having any COVID or spreading COVID come Thanksgiving Day if you do have any get-togethers. Schools, what's going on with schools? You hear different things going on in different parts of the country. New York City, for example, they're looking at closing schools down because they had said if they get a certain positivity rate, they'll close them down. They're getting close to that positivity rate, but is that what they should be doing? And then the vaccine. You probably heard some new vaccine news that has a lot of people excited. I'll explain that and what that means, and particularly what it means for you and the area you live in going forward here. So first, let me start with Thanksgiving. So Thanksgiving is about 11 days away, so we're getting closer and closer to it. Now, overall, the general recommendation, this is from the CDC through a variety of experts, are saying the best thing you can do for Thanksgiving is not have anybody come into your house other than your own household members that are there right now. That's the best way to stay safe. And I know Thanksgiving is a typical time period where we get together with families and friends. That's the big holiday to do that. But remember, we're in the midst of this pandemic. We are seeing upwards of 170, 175,000 cases a day here in the U.S. That number has dropped a little bit since over the weekend. But again, those numbers are a lot higher than we thought they would be this time of the year. And we haven't even gotten to that holiday season yet when families are going to start to gather. And that's the big concern. So again, overall, number one, the main thing is to go ahead and just do it with your own household members. By far the safest way to do it. Now, some recommendations are to cook your own food. Other recommendations are to go ahead and get food from mom and pop stores around you. Just try and support them. But if you do that, do it on a takeout basis. Do not go to the restaurant. Get your own food and bring it home, and that way you know it's as safe as possible and you're supporting your community, which is also an important thing. So, looking at it, overall, household members, they're by far the safest. The next level of safety, those are the quarantine bubble you might have had. In a quarantine bubble, if you remember a few months ago, we talked about expanding your own household. So instead of the 4 or 5 people in your household, you've expanded it another 4 or 5 people, no more than really 10 people, who are part of your quarantine bubble. And these are family or friends that you keep a close eye on them, they keep a close eye on you, and everybody knows pretty much what everybody's doing as far as staying safe during the pandemic. Wearing masks, social distancing, only going out when needed, not being in large gatherings, those types of things that you know you can keep yourself safe. And I'll talk a little bit in a minute about masks and social distancing during the event and what that means. You don't have to worry as much with people who are in your quarantine bubble if you trust them implicitly. If, in other words, you know for sure they have been safe. But if they haven't, then think about masks and social distancing. I'll explain why in a minute. And then the other thing are the people outside that. So again, level number 1, household members, the safest. Next level of safety, your quarantine bubble. Makes it a little riskier. And then the riskiest one are bringing people other than those 2 into your household. If you do that, there's a couple of ways you can make it safer. It's never going to be safe, but there are ways you can make it safer. And by that, I mean there are things you can do to minimize your risk of spreading or getting coronavirus. So, number 1, start today your self-quarantine. And by self-quarantine, I mean exactly that. Do not go out. Only go out for necessities. If you have to go to a store, go to a store, get back home. No gatherings, no bars, no restaurants. When you do go out, masks, social distancing, extremely important. Now, the big question I get is, okay, what about testing? Should people get tested before they go to somebody's house? Here's the deal with testing. If you get tested, depending on the type of test you get, it might be very accurate, it might not be as accurate as you like, especially if you don't have symptoms. But the problem is, the test is a snapshot in time. So let's say you get tested on Wednesday and you test negative. Well, come Thursday, Thanksgiving, you could be positive that day. You just didn't test positive the day before because it hadn't built up in your system enough. And so again, it's a snapshot in time. However, there are ways to improve the accuracy of not necessarily the testing, but the results of testing assuring people that you don't have COVID. And the best thing to do Again, quarantine. Optimally, you want to quarantine for 14 days. We're about 11 days out, so this is your best stretch here of going 11 days to quarantine. And then at the end of the quarantine, getting tested. If at that point you test and you have actually strictly quarantined for those 11 days, then you can be more assured that you're not infected. But that doesn't mean absolutely that you're not infected, so you want to still wear masks and social distance, especially, and like I said, even with your quarantine bubble and the people that are outside your bubble, especially if you have somebody in the house that's elderly or has medical conditions that put them at a higher risk for complications from COVID. If that's true, then you definitely want to social distance. But what can you do when you're actually in that environment itself? Well, there's a couple steps you can take and a couple things you can do. Number one, you want to go ahead and minimize the time frame that people are around. And so that means instead of having a huge all-day event, just have people over for dinner, and then they leave after dinner. That might leave you with a big mess to clean up, but it's better to clean up a mess than have somebody get COVID, not something you want to have happen. On top of that, you want to make sure when people come over that they wear masks, they're social distancing. Do it outdoors instead of indoors if the weather allows that. If the weather doesn't allow it, go indoors, but open windows if you can. And if you can open windows, then if you cannot open windows, then you have to be very, very careful because you're not getting that ventilation. And so you probably want to do more than that 6-foot social distancing. The other tip I've been giving people, it's not the prettiest environment, but if you can move your cars out, put the table in the garage, open the garage door, even with heaters on, that gives you a little bit of warmth in there. That's a better environment than inside the house. So think about that fourth W. Wear a mask, watch your distance, wash your hands, and then windows. That's the ventilation part. That can really help you keep it under control. But remember, again, it's minimizing the amount of people, minimizing the amount of contact time that is going to minimize your risk of getting coronavirus. Now, if somebody is traveling, that's another concern. How are they getting there? By far the safest, let's say they come a couple hours from another town. If they go a couple hours, stay in the car with just household members and don't stop anywhere, the risk is very minimal. However, if they're flying, their risk is going to be higher. The airplanes themselves we know are safer, but the airports can be issues because it's hard to social distance in the airports often at certain times. And so be careful there. And if you take a train, even more so because the trains can be crowded. So, or a bus, the same thing. So again, overall, the best thing is to only have household members. The next step is your quarantine bubble. And then the third step are people outside of that quarantine bubble. You want to be extremely safe. When you're in the house, I always joke around, remember the kids' table? Nobody wanted to be at the kids' table. And you were so happy when you got from the kids' table to the adult table. Well, now instead of having kids' tables, have family tables. So if you have family members, if it's a couple together, put them at their own table. Put your family at a different table that's socially distanced and appropriate. Because remember, when you're eating, you're taking your mask down. Plus, when somebody's serving dinner, have somebody serve it. That way they clean their hands before they're wearing a mask, they're serving it. Not everybody's touching the utensils, not everybody's digging in for the mashed potatoes. And if you have condiments, individual compliments can help. Don't share anything either. No hugging, no kissing this year. Those are things we have to do. And then hopefully next year we can get back to our normal Thanksgiving. You can have the biggest gathering you want. This year we just want to make sure everybody stays safe. Last thing you want is for somebody to get sick because you ended up with COVID, didn't know it, didn't have symptoms, somebody got it, and ended up getting very sick from it. Not something anybody wants to have happen this year. But overall, hopefully everybody has a happy Thanksgiving. It's going to be a bit different this year, but it doesn't mean it's not going to be a fun time. Just you have to be a little imaginative about it. Now, the second thing I want to talk about are schools. What's going on right now with schools? Because, again, you've probably heard a lot in the news over the past few days about schools, whether they should stay open, whether they should stay closed. New York City itself is getting to the point where they have to make a decision because Mayor de Blasio a few months ago came out with a statement saying that once positivity rate reached 3%, they were going to automatically close schools down. There's going to be a knee-jerk reaction. Well, positivity rate, the last one I saw was 2.57. And so it's getting close to that 3%. So a lot of officials, a lot of parents are saying, well, okay, we're getting close to 3%. Does that mean you're going to close schools? And it's unsure exactly what's going to happen at this point. But the important thing is schools themselves and looking at it and what that means. I talked to a lot of experts last week for a story we're doing about schools. And the experts uniformly told me the same thing. Schools are actually fairly safe environments. And one of them, her name's Dr. Emily Oster, she's out of Brown University, actually did a study, and it was interesting. Starting at the beginning of the school year through October, they looked at 47 states and looked at illness reports. 220,000 students, 63,000 staff members were involved in the survey they did. And they found out, guess what the infection rate is for students and staff members? It's a lot lower than I think most people think. Because if you remember a few months ago, we were concerned that schools would turn into super spreader centers. The children would go to school, they'd take it back home, they'd spread it at home, people would get sick, people would die because the schools are back in session. Well, it turns out that's not the story. Here, again, 220,000 students, 63,000 staff members. The students, the infection rate was 0.13%. That's a little over 1/10 of a percentage point. Staff members, 0.24%. So that's a little under 1/4 of 1 percentage point. These are extremely, extremely low infection rates that are happening in school systems. And there's a few reasons behind that. Number one is because schools are very good about making sure that students are wearing masks, they're social distancing, and they're washing their hands. As a matter of fact, again, this study and others have shown that the schools that did that in particular made sure students wore masks, cut down the number of students that are coming in, so maybe having alternating schedules, because that way if they had lesser students, they could open up the social distancing, and those were the ones that had the lowest infection rates. On top of that, we also know that the lowest infection rates were in the elementary schools for a variety of reasons. Now, there was a big concern at one point that these students would be taking it home, coronavirus, not having symptoms, because children typically don't get symptoms, and they would be spreading it to adults, especially vulnerable adults. Isn't happening as much as we thought. Doesn't mean they're not getting it, because children who do get it still have high viral loads like adults, but they're not spreading it to adults as much. We're not exactly sure why, but we think it might have to do with the fact that they don't breathe as heavily as we do, they don't sneeze or cough as forcefully as we do, and plus, if you think about it, children at a lower level, and so there's a bigger distance between their mouth and nose and your mouth and nose, and so that can help a bit as well. But the other thing we know, elementary school students, less chances of spreading it, their infection rate was much lower than high school students. And high school students, for a few reasons, have higher infection rates. One is they're closer to adults, but the other thing they found out is those infection rates don't seem to be happening at schools themselves, but they seem to be happening at extracurricular type activities, particularly locker rooms. I talked to these experts, I said, football, volleyball, soccer, basketball, what are the riskiest ones? By far they thought the riskiest one was basketball, just because there's such close proximity there. But even with these sports, they said, outdoors is better than indoors. But the thing you have to know is it wasn't the sports themselves on the field or the court, it was when they went to the locker rooms. That was a big issue. Or a lot of these sports teams had parties on the weekend. So in high school, it wasn't actually the school environment, but it was more what they did after school. Locker room activities, extracurricular activities, weekend activities, including weekend parties, that were a driving force behind some of these. Now the other thing, there's a big debate out there about, okay, should we close bars and restaurants or schools? What these experts told me is you shouldn't, well, a few experts said, okay, number one, schools should stay open, close bars and restaurants, because that can get the community under control, coronavirus-wise, and then that can certainly help the schools out. Other experts told me, if you're going to shut one down, you should shut the other. So if you shut schools down, you shouldn't shut schools down without shutting bars and restaurants down, because it just doesn't make sense from a public health perspective. If you look in Europe, what they're doing is they're shutting everything else down. Bars, restaurants, having people stay indoors, but keeping schools open, because that's how important they feel school is for children. They don't want them to miss out on this important developmental time period they have, especially the younger children. So again, think about those infection rates, less than 1/10, or a little more than 1/10 of 1% for students, a little less than 1/4 of a percentage point for adults of infection rates over this nationwide survey they did. So very, very low. And then the last one I want to talk about is the vaccine. There's been some news out. A couple of vaccines have come out with their effectiveness. Now, if you remember, a month or two ago, we were hoping for an effectiveness 50 to 70%. That's higher than the flu vaccine, lower than some of the other vaccines that have been around for a while. But since this is a new vaccine, they're hoping for 70% at the best end. But instead, what we find out, last week Pfizer said a little more than 90%. Moderna today said 94.5%, so almost 95% effective at protecting you from getting coronavirus. A few caveats here. Number one, these are still limited numbers. With the Pfizer vaccine, it was with the Moderna vaccine, it was 95 people that had gotten infected. And we talked about this earlier. Here's the way the studies work, is they give tens of thousands of people the vaccine, or a placebo. Nobody knows at the time until they open up the study later on and they can look at the data. So they give them, let's say there's 15,000 people, 30,000 people. 15,000 get the vaccine, 15,000 get a placebo. Then they have them go about their regular lives. They watch them. In the case of these two, they get a second vaccine and they keep an eye on them. And then they wait for infection rates to build up. once they get to a certain number of infection rates, they open up and they say, okay, the people getting infected get the placebo or the vaccine. Well, in this case, both for Moderna and Pfizer, the vast majority of people, over 90% of people who got infected had not gotten the vaccine, they had gotten the placebo, which means, well, for Moderna, almost a little more than 5% of people who got infected had gotten the vaccine. So in other words, it protected 95% of the people. With Moderna, it protected 90% of the people from getting it. So that's very, very good news for the vaccine. However, remember, these are preliminary results. Both companies are saying that side effects were minimal, but they still need to follow them for a couple of months to make sure those side effects aren't any worse than they are right now. And then they have to seek that emergency use authorization, which is going to take a while. Both companies are saying they expect it to happen, to start seeking emergency use authorization from the FDA by the end of the month. And that means probably by the end of the year, beginning of next year, we'll start seeing the vaccine. It'll be distributed in phases. When it comes to distribution, this is another part of the good news. Moderna has found out that their vaccine does not require ultra-cold storage. And this is important because ultra-cold storage, which is what the Pfizer vaccine and other ones require, and remember, both of these two are double vaccines. In other words, you get one initially and then one a few weeks later to get you full protection. But the difference being, Pfizer vaccine needs ultra-cold storage. So it's minus 70 degrees centigrade, which is minus 94 degrees Fahrenheit. That's very hard to get. You need special equipment, and that equipment can cost $10,000, $15,000. And so you're not going to see it at most pharmacies. You're not going to see it at your doctor's office. The difference is with Moderna, they have found out that theirs can store for 30 days at normal refrigerator temperatures. So you will see this at pharmacies, you will see it at doctor's offices. It'll make it much easier to distribute. It'll be much easier to get because it's coming into the communities instead of people in the communities having to go to special vaccination sites. And worldwide, it can help as well. And so again, this is good news we're having. It's preliminary news. There's other vaccines to follow as well, but Dr. Fauci and other experts are saying they have confidence that other vaccines will show the same thing, and this can certainly help. But remember, even though we all have vaccine fatigue, even though we all have pandemic fatigue, you still need to keep wearing your mask. You still need to social distance, wash your hands, open windows, all those things that can keep us safe while we wait for the vaccine, and probably even after the vaccine to make sure that we stay safe, we get through this pandemic, and we get it under control. Distribution will take months. It's not going to happen overnight, but it will happen here sooner rather than later, I think, and a lot sooner than we thought, and more effective vaccines than we thought. So again, going over the headlines real quick before I answer questions. Number one, Thanksgiving, you want to be safe. Stick to household members if you can. Number two, schools. It looks like schools are a lot safer than we thought they were, but one recommendation that I did forget to mention is the experts uniformly said also what I would do if I was running everything is I would shut schools down Thanksgiving break and bring them back after New Year's. That way they're not going back and forth because that can cause issues as well. So just food for thought. But these are temporary shutdowns, not permanent shutdowns or even shutdowns associated with community issues. And then number three, the vaccine. Great news. The effectiveness looks like 90% plus for these two vaccines that have come out with, and there's no reason to doubt the other vaccines won't be at least close to that. Let me see if you have any questions.
What's the difference between recovery rate and illness?
So the difference between recovery rate and illness is, well, number one, so the illness are the amount of people who get COVID out of coronavirus. Coronavirus is the vaccine. COVID is the disease associated with the vaccine. And the best example I can give is HIV and AIDS. HIV is the virus. AIDS is the actual illness from the virus. So again, I think I might have misspoken and called it a vaccine. So coronavirus is the virus that causes COVID, the illness. And so majority of people who get infected don't get symptoms. So they're not getting COVID, they're just getting the virus. Those that do get symptoms, the majority of those recover. And so they have COVID illness, but they recover from it. And then there's those who get more critical symptoms from that and die from it. And so that's basically the difference between you can get COVID, you can get coronavirus, you can get coronavirus and not get the illness COVID. You can get the illness COVID and recover fairly quickly or have very minimal symptoms, or you can get COVID and have more severe symptoms, and that's what makes it the illness. And so hopefully that helps with the confusion a little bit.
Is it safe to purchase prepared Thanksgiving dishes, food from local businesses?
So the question is, and this is actually a really good question, is it safe? Because what I mentioned in my Thanksgiving part of the headlines is, if you want to support your local community, go ahead and get food, takeout food, not dine-in, but takeout food that you can bring back to your house to prepare it. So instead of cooking your own Thanksgiving meal this year, get that. And the question is it safe? If you get it appropriately, meaning that it's a place that you trust, they have done appropriate things, they're wearing masks, cleaning their hands while they're preparing the food. You get the food, you bring it to your house. Much like if you go to a restaurant and get takeout food at a restaurant that you trust, it can be just as safe there. However, you do want to be careful when you're going there. Obviously, wear masks, social distance. Don't greet the person who's giving you the food, and just do the things you typically do at restaurants these days. The same thing you would do on Thanksgiving with those meals.
Should we be concerned with any side effects of these vaccines? It seems like they were developed way too fast.
So the question is, should we be concerned with side effects of these vaccines? And that's a fantastic question. And that's a question that has been asked over the last few months and will continue to be asked over the next few years. Because the honesty of it is, right now, short term, the side effects look minimal. There was some indication of a couple different vaccines that they had to put a pause or a hold on their trials because they were having side effects or they were having issues in some of their volunteers. Now, what we have found out subsequently is some of those volunteers had their issues but ended up receiving a placebo. They did not get the vaccine. And that's the way trials work. So give it to 30,000 people. In that group of 30,000 people, people are bound to get some kind of sickness just because of the natural history of people and how they are. So they'll get sick, and then what they'll do is they'll pause the trial and they'll say, we need to make sure that what they got in that trial, the sickness they got, whatever happened to them, wasn't a result of the vaccine. And so they'll look at it, and then they'll eventually break open the data, and they'll go, okay, that person got a placebo, had nothing to do with the vaccine. Or that person was already sick when they started the trial, it just hadn't manifested itself yet. Or the worst case scenario is the vaccine caused that. And so we need to be very careful and go back to square one. In these cases here, what they found is that the vaccine did not cause what was going on with that in the majority of cases. But they're still investigating it. And that's why the FDA has said, okay, it's fine. You give the 2 shots, you get the results that we're looking at, you seek emergency use authorization, but we still want you to follow them for 2 months, because 2 months is the time period when the majority of side effects will take place in that time period. Sure, there are long-term side effects that could happen years from now, but like any other vaccine, like any medicine, like pretty much anything we do, we're not going to know the long-term issues until we get years down the road. And we're in the middle of a pandemic. We need something like this now. And so anytime you take anything, anytime you take a vaccine, anytime you take a medicine, anytime you take any supplements, anything that's out there, you always have an increased risk of things happening. But you look at the risk-benefit. In this case, if you have an infection, most of us don't think twice about taking an antibiotic. Antibiotics have a few side effects that can happen with you. It doesn't happen with everybody, but they could happen. But the risk of those side effects, which is minimal, is outweighed by the benefit of getting the antibiotics and taking care of whatever infection you have. Same thing with the pandemic here. The risk of the vaccine side effects, which at this point seem to be minimal, are outweighed by the benefit of getting that, protecting you from COVID, which we know can be a risky virus to get. COVID can be a risky disease to get and a fatal disease. And so the benefit is much more of getting the vaccine at this point. And it doesn't look, at least what experts are looking at, is the long-term effects aren't concerning at this point. So, but time will tell as we go on. So again, thank you for your questions. Fantastic as always. Going over the headlines again, number 1, Thanksgiving. If you are going to go to somebody's house for Thanksgiving, start quarantining today. You're a few days shy of the 14 days that we like to have a quarantine, but 11 days is better than none. And so quarantine yourself today, but even when you're there, wear a mask, make sure you social distance, especially if there's elderly people or those with medical conditions that put them at a higher risk for complications from COVID. Number 2, schools. Research has shown that schools look to be a lot safer than we thought they were. However, especially when students start getting into high school, schools aren't as safe, but that's mostly because of activities that happen outside of school. Locker room activities, weekend parties, those types of things. So we have an understanding of that. And then the vaccine, great news. 2 vaccines so far, Moderna and Pfizer, both of them above 90% effectiveness, which is much higher than we thought would happen. Best guess, they're going to start seeking emergency use authorization by the end of the month. We'll get that hopefully by the end of the year, beginning of next year, and they'll start giving people the vaccine. As Savannah said on the Today Show, shots in the arm starting in January timeframe, and then it'll be phased in for different groups of people. Most people will probably get it March, April timeframe. But like always, I hope this week turns out very well for you. Let's try and keep those numbers down by everybody wearing masks, social distancing, washing your hands, opening windows, not going in large groups. Those things we know that can help us keep the numbers down. We all need to do our part to get this under control, and hopefully it gets under control sooner rather than later. And for the rest of the week, as best you can, I hope you stay happy and I hope you stay healthy.